Hello there. Today I'm going to be talking a little bit about treating patients with fibromyalgia. So, what is fibromyalgia? Fibromyalgia is a pain disorder which is categorized by widespread pain and is often accompanied by fatigue as well as anxiety and depression. While the cause of fibromyalgia is unknown, altered sensory functioning of the brain is thought to be involved, and certain studies have shown that the areas of the brain that are used to control the amount of pain information coming into the brain kind of shut off some of those pain signals from being sent in from the rest of the body are decreased in functioning in patients with fibromyalgia. On my first clinical rotation as a doctor of physical therapy student, I knew what fibromyalgia was, but I didn't really know about what you would do to treat a patient with fibromyalgia. We had a woman come in after a total knee surgery and total knee replacement surgery. And um, my clinical instructor told me that she also had fibromyalgia. And I remember when she told me, she didn't seem especially excited about the fact that this patient had fibromyalgia, and told me that she did, in her experience, that patients with fibromyalgia could be difficult to treat. And the patient's symptoms surrounding fibromyalgia did alter our normal treatment progression for a patient following this surgery. While many patients don't necessarily enjoy the scar massage and the massage of the muscles that tend to be tight in their thigh after surgery, this individual was was different. It was much more increased. We definitely couldn't get anywhere near her incision, um, and with even the lightest touch to her thigh, the skin on her thigh, she was in excruciating, intolerable pain. And when we moved on to exercise, similarly, exercise can be hard for someone after the surgery, but she tolerated less than any other patient that we had worked with, that I had seen, um, that had gone through this surgery. And my instructor told her that we were going to try to be increasing the amount of exercise she could do, um, and that she should gradually increase the amount that she could do at home. Also, to address the sensation, the problems with touch that she was having, then my instructor took about 30 seconds to just ask her to try to touch her leg at home, basically, and try to increase the amount of touch that she could tolerate, the time, the pressure. But even with these suggestions and recommendations for what she could do at home, in the next couple sessions, she really didn't show much progress in either of the areas with the sensation or with exercise. And after one of these sessions, my instructor expressed to me that she didn't believe that the patient was really completing what we asked her to do at home. And I remember trying to look into things that we could do for this patient, and seeing that a gradual increase in exercise was something that would benefit the patient, and that different pain management methods like electrical stimulation, which was something that we were using in treatment, and the desensitization were things that could help. So we're in my mind, we were doing things that we should have been doing, and so, but I felt like there was something more we could have done, and I wasn't sure what that was. She eventually became very emotional um, about her lack of progress, because she wasn't hitting the markers that you would normally want to see in a patient after the surgery, and she eventually dropped out of therapy. So I have continued to think about this patient over the past year, and still just had that feeling that we could have done something else for her. And over combined with the past year of my education, my continued education in classes, and then combined with a more recent search on treatment of fibromyalgia, I've come to realize the big gaps that we're missing in our treatment. And apparently, in a lot of other therapy treatment as well, because it turns out that dropout rates for patients who have fibromyalgia and um, a decreased adherence to exercise is actually pretty common in this population. So, what are we as physical therapists doing wrong? What were me and my instructor missing in our treatment? So, first off, um, the psychological aspect of this disease needs to be addressed in treatment, and that was one thing that was lacking in our treatment. Our patient clearly expressed some emotional distress that she expressed during sessions. And while we comforted her during sessions and expressed that stress and emotion were normal after surgery, um, and just kind of encouraged her to hang in there and get through it, um, we didn't really investigate how her emotions were affecting her ability to complete her exercises at home. And while we asked her at the beginning of every session how her pain was and how her function was, we didn't ask her how her psychological health was doing or how her anxiety was that day or anything along those lines. And anxiety and depression are they're commonly things that happen alongside of fibromyalgia, and increases in either of those things can cause a bigger flare up in pain of fibromyalgia. Also, a traumatic event, either emotional or physical, can cause a spike in fibromyalgia. So it makes sense that after the surgery, our patient was having such a big spike in her fibromyalgia. Furthermore, stress in general is known to amplify pain of all types. So, really, psychological factors should be a component of all patients who are experiencing pain. As physical therapists, there are things that we can do to help with stress during therapy. We can do relaxation techniques such as mindfulness or meditation. We can lead them through breathing exercises or muscle relaxation exercises, which could help to manage their stress. Obviously, patients or physical therapists who are not trained in counseling someone with anxiety or depression shouldn't be solely responsible of trying to get rid of those things, or taking care of the anxiety and depression themselves. But those things should be monitored, and you should look at how that's affecting their ability to complete their exercise program and how that's affecting their pain. When their anxiety is high, is their pain much higher? Uh, and if you see a trend in neither of those things and it's consistent, then you might want to have a conversation with your patient about going to see a psychologist, and referring them to one, which can be a tricky conversation to have. But I think if it's had in the right way, then you can do it without being offensive. A second thing that was lacking in our treatment was proper patient education. While we took the time to do the typical education we would do surrounding a total knee replacement surgery, we didn't really delve into anything regarding pain psychology, anything regarding fibromyalgia, or stress and how that can affect pain. Um, Another area where we kind of lacked in patient education was we really only talked to her about trying to increase the sensitization that one time, and maybe very briefly, and then every once in a while maybe we'd ask, oh, are you still doing that at home? And she might say, oh, I'm trying to. But we didn't really delve into, okay, when are you going to do that, and how long have you been doing that, and just giving her parameters on how she could progress that. Or we didn't tell her why, really. We told her it might help her be able to tolerate more, but we didn't go into anything deeper than that about why this would be a good thing for her to do for herself. And patients should be educated on how pain works in the brain and educated on how stress and emotions can amplify their pain. And you do want to make sure that you're not sending the message that the pain is all in their head, because that's not a message that they're going to want to hear, and one that they might have heard before and not liked hearing. But I think if you have a respectful and empathetic conversation about how their very real pain can be amplified by stressors, then that's going to be an important conversation to have and educate them on. An education strategy that's worked in patients with fibromyalgia in the past has been to do step number one. It's two-step problem. Step number one is going to be the identification. Sorry. It's going to be the identification phase. And in the identification phase, you're going to not only do education on how pain works in the brain, but then you're going to identify stressors in that patient's own life. And then in the action phase, then that you're going to present the patient with different options on ways they could tackle that stressors, or maybe ideally the patient could just think of ways that they would avoid those stressors themselves and kind of create a management program for themselves. Our patient demonstrated kinesiophobia, which is a fear of movement due to pain. So that's a possibility for these patients. But you can also have people on the other end of the spectrum who just want to keep pushing themselves to their limit and cause themselves to be constantly flared up because they're trying to do too much. And either way, you kind of want to educate the patient on having that balance between having enough activity and not doing too much activity, and how they can find that balance where they're going to get the benefits of exercise without having themselves be completely flared up. And for the patient with kinesiophobia, being empathetic and saying that it might be painful to start exercise and it might be hard, but in the long run, that it's been shown to help people with the same condition as them. Finally, you want something that was lacking in our treatment was a really good, solid patient and practitioner relationship. And you want to have a communication that's all encompassing, and make sure that the patient and the practitioner are on the same page. There's been research that shows that when a patient and practitioner aren't on the same page, they use surveys where each of them rated the patient's well-being in psychological health, emotional health, and physical health. And when the patient and practitioner differed more on those things, then less compliance with the exercise program were shown. And that makes sense, because if the practitioner is prescribing exercise with the issue that they think is the most important and the patient thinks something else is most important and the biggest issue, then they're not going to follow that plan that you set up for them. Another component that should be emphasized is that the patient's recovery should be put in their own hands. And we, as healthcare practitioners, can present them with the evidence or the options that are available and the evidence possibly on which things have been shown to work the best. But really having that patient autonomy and having the patient take charge of the things that they like to do, the things that they think would help them the most, and what they could see themselves actually doing is going to provide the most benefit. And individualized patient-based care has been shown to be the most effective in patients with fibromyalgia. Finally, there needs to be a level of empathy in treatment, and I think that was lacking in our treatment of the patient that we saw. My instructor was always very nice to the patient during all of our sessions, but I don't think she was completely empathetic for the aspect that fibromyalgia brought to this patient case, and I think that showed through the lack of time that she spent um, addressing fibromyalgia in the treatment. Fibromyalgia isn't as concrete of a concept as a surgeon cutting into your knee. However, it is a condition that causes real pain in people, and over almost 5 million people in the US. So the chances that you're going to be in a non-pain specialty clinic or field and see a patient who comes in for something else that has fibromyalgia is pretty likely. And when that happens, fibromyalgia shouldn't be seen as something that is a hindrance or a barrier to the treatment that you want to do. It should be seen as something that can be addressed, can be treated, and should be taken into consideration as part of a comprehensive treatment program. And while in our treatment we may have attempted to use valid treatment options, they weren't effective, and they were unsuccessful because we didn't address the patient's mental health. We didn't give enough patient education in the right areas, and we didn't build that proper patient relationship that was, I think, really would have helped out in the case. And while ensuring to address all these three things in people who have fibromyalgia is especially important, I think that they're all things that could help any patient that you have that is going through any type of pain. And all these concepts are things that I definitely want to incorporate in my future practice as a future healthcare provider. Thank you.